For the glowing endorsement. This is wonderful. I don't get this too much, except when I'm out of town. I get these kind of platitudes, but I thank you so much. So welcome everybody, and as you know, we're always trying to incorporate kind of the flipped classroom model. And so I had a pre-reading for you. So our quiz for you, without looking at this particular point, what are the two structural elements of multiple choice exam questions?
Stand.
Oh, very good. And the options. Very good, exactly. And what is the one rule that we always want to have when we have multiple choice questions? What is it about the answer? So I'll give you your handout just in case you didn't have it. Is there's only one best answer. Okay? And that's probably the most fundamental point that you should know. Linda, is that what the right name is?
Yeah.
Yeah, we got two-sided account. So the pre-reading was really intended for that, to give you some insight into what constitutes a question, the anatomy, if you wish to call it that, for the multiple choice question. On the back, we have an exercise for you, which we'll do in just a few minutes. So the elements here are pretty much this. Admittedly, it's been a while since I've had the opportunity to do a session like this, a number of years, and I'll tell you why. Because here for our medical students, we have our clinical campus students, which would be third and fourth year students. Okay. So the preclinical years, first and second years, spend a lot of time taking classroom type learning, if you wish to call it that, mostly from basic scientists, for the most part clinicians as well. There's a lot of testing that goes on. So the National Board of Medical Examiners, the NBME, so the courses that I would be on at the medical school assist them in being able to write questions, because we want to make sure that we're testing true knowledge. We've all had experience. Every one of us have had experience with taking written exams. Every one of us has, right? Going back to who knows when, right? And look at some of the questions are not very good for a whole variety of reasons. So we're going to explore those so that you can be more discerning and more specific in how you're constructing test questions. So at the end of the CME session, as an example, be it live or online, you may have embedded a few outcome questions based upon the content. What else would you do? And typically we use multiple choice for that purpose. So, like I said, it's been a while since I've done this, and I've always enjoyed it, but it's been a while because, once again, we don't have the preclinical students here and not designing exam questions. So be that in cardiology or anatomy or physiology or whatever. So it's been a while, but still, here's an opportunity to do that. So once again, the flipped classroom model, number one, and the microphone is
It's in the computer itself.
So should I be standing here necessarily?
That would be good. Well, or speak up.
Oh, okay. So anyway, so this is our test item writing and analysis session for CME 101. And we'll learn a little bit about how to actually construct and also to be able to analyze test questions. That's a refined activity that hopefully you'll find at least have some appreciation for. So our learning objectives for today is to describe what are the purposes and methods of testing, why do we test, how do we construct what's called the West One Best Answer rule, recognize and correct and avoid some of the common flaws in MCQs, okay, of which you'll recognize some, and I'll introduce you to what's called a test blueprint, which will help you kind of put together the pieces. So for our previous sessions we've had on measuring learner needs, on writing learning objectives, all are part of what's called the blueprint to be able to help you as a course director, course coordinator to be able to do that effectively. So why do we do testing in the health professions?
See if you gain new knowledge.
So sure. So to determine the learner's knowledge level. That's another reason for testing.
The effectiveness of your teaching.
Well, I would think so. That's exactly it. And if you remember what we've done before with respect to learning objectives is that the testing should map to what your objectives are. I know that sounds probably self-evident, but you want to have some coherence there. So what you're teaching, what you're testing is what you should be teaching. Okay. It's an expectation for outcomes because we've learned through all of our education, right? You can't take the next course in the sequence. Okay. You can't take organic chemistry unless you've had basic chemistry and be able to pass it. That's how they go. So it's kind of that. So we use testing as a marker for achievement. Okay. You can't get a license as a physician, as a social worker, as a therapist unless you've taken tests, right? To be able to know, to be able to measure only one thing, and what is that? Knowledge. That's all that really measures. If you remember from Bloom's taxonomy, which we'll show again, maybe some elements of application, but not much more than that. So we use the simulation center as an example for measuring what? Skills and performance and how you can work together as a team, and we videotape those things and we give you feedback on them. We debrief those things. Okay, that's a much higher level, but certainly when it comes to testing, especially multiple choice questions, so communicates to the students what's important. So this is what's going to be on the final exam. Well, nobody ever gets that specific. Okay, but if you had a study guide, which I do for my students, I give them some broad categories so it helps you be more efficient when you're learning. So that's one of the things. Isn't it a motivator? If you weren't being tested, of course, pass-fail to me would be the best in the world, but it's a motivator, right? You want to be able to learn this stuff. And I find out what are some of the deficiencies or the areas for remediation. Okay, so you get that midterm exam back and you find out, oh boy, there's an area I need to work on some more, and it really helps to do that. Once again, as I say, for final grades, and but then also in measuring the course, and that's the last one there. So what are the weaknesses in the curriculum? You'll certainly find that. So as I said, match to the learning objectives. Testing is done devoted to each topic which reflect its importance. So once again, so we need to ask ourselves too, when you have a single course, it's probably fairly easy. When you have multiple courses, you need to think about what are the priorities or the themes, okay, that you have for that sequence of courses. What are the most important things? And those aren't those the things you should be testing? Or should you be having minutia in there, kind of gotcha questions to see if you were paying attention? If you have, how many of you have taken night courses? All of us have, right? So you worked all day, you go, you're working on your degree, master's or whatever, and here it is, the class is still going at 9:30 at night, and you're just anxious to get back on the highway to get home, to get your life. And there was some little tidbit that the instructor threw out there for you, long since forgotten, some little trivia thing to see if you were paying attention. That ain't no good, is it? Of course not. So anyway, once again, so it's needs to, and it should be representative of what the goals of the course are. Seen this before? So that's Bloom's taxonomy. So once again, where, if this works, is this going to work? Ah, super. So how far up can multiple choice questions go, do you think?
Analysis.
Yeah, boy, just touches analysis to some degree. Okay. So we do that in medicine a lot with our board exam questions, and we have one example for you, and many of you have seen that. So having some basic knowledge about pathophysiology, about acid-base metabolism, being able to apply that to a case and be able to analyze what is the best treatment. It's about as far as you can really go, but anyway, so Bloom's taxonomy is something that's certainly representative here. So here's one example. So by the end of this course, students will be able to assess anatomy and physiology of the nervous system. So somebody want to read the stem?
In the spinal cord, primary fluids supply to the spinal thalamic tract
Is. Okay. So here are some lists of options, right? I'm not terribly sure which is the correct, but it's probably not really important here. But certainly you've seen that, so the options, generally 4, sometimes 5. Okay. And as we were just talking about, higher order ones, analytic ones. Okay. So here's a patient presents with these symptoms, some vital signs, facial weakness, sensation is intact. The most likely diagnosis is, and we use this quite a bit, especially in medicine, I think, well, probably in PEDS too, but I do a lot of work with our residents in medicine, and so at the end of our case conference, we have 1 or 2 board type questions, and this would be amongst those, and we use audience response. Isn't that a fun thing? So people can actually give their response in kind of incognito to a certain degree. And correct answer might be B here. I don't really know, and it's really not that important, but the importance is how it's displayed. Let me just leap ahead and maybe to cut down in time a little bit. So what is their, if you were to, if I can do this mechanically, if you read this question without even looking at the options, might you be thinking of a response? Okay. So if this was a course in, say, neurology as an example, okay, is this something that, so what we oftentimes say is cover the answers. Okay, so by covering the answers, you're already thinking about what is the most likely, and here they are, as opposed to reading through every single one of them. So you're already looking for the right answer, or the answer you think is correct anyhow, right? So that's one way to do that. Other thing is, once again, is to cut down on time here. Notice how these are ordered. They're in alphabetic order. Okay, so you have A, G, M, P, P. Why do you think that might be a good strategy to put them in alpha order? You as a examiner. To prevent what many of us think that, B is probably the right, if I'm going to guess, I'm going to guess B, right? You oftentimes done that, okay? Or thinking that statistically maybe B is the right answer most often. But in this case, you would never know because they're in alpha order, okay? So that's an effective way to line them up in a alpha order. Anyhow, just a couple of quick points there, and we'll get in a little bit more. So some of the general rules: make sure the items can be answered without looking at the options. Okay. As we say, cover the options. Include as much of the stem as possible. Include as much of the item in the stem as possible. Okay. Typically, this: long stems, short options. So how much time, okay, many of you have taken board type exams. How much time should you spend on each question when you're taking a high stakes exam? About a minute? Yeah, about a minute. So these should be constructed in such a way that it takes just about a minute to read, decipher, respond. Okay. So obviously tremendously lengthy stems, everything about, and writing the stems is an art. Because it needs to be what? Well, certainly accurate, no question about that, but succinct. Okay, so how much extraneous stuff can you take out and still make it meaningful? We could go back to, let me see if I can go back. Yeah, so here's a 32-year-old man that lives in Hempstead and has a wife and 4 kids and works at the factory plant. He's been there for 10 years, and sometimes he smokes, sometimes he... Who cares? Okay, so how can you make it short? Okay, and that's really kind of the essence for what you want to do there. Okay. Write options that are grammatically consistent. We'll talk about that. Right, distractors. What's a distractor? I mean, yeah. So almost implausible. Almost. Not too far-fetched, but okay. So we could have gone back to our the neurology exam question and put something in there related to arthritis or something, okay, which would not be the right answer, but by the same token. So the idea is to avoid guessers, okay. So people that are test wise. So when it comes to, if you all have children that are taking a standardized test in school, okay, and hopefully you're able to see the type of questions that they have. There's a lot of psychometrics that go into designing these kind of things, but by the same token too, it's to be able to measure what? What do we say in the pre-reading? One best answer, right? Okay. So, write distractors that are plausible and at the same relative length. What is there about long option answers that are attractive? They're attractive, aren't they? Oh, it's long, it must be the right answer. So you want to avoid the lengthy ones. How about always, never, all? And why aren't those effective? So, patient presents with X, Y, Z, and usually has this outcome. Pick one of them. What's deficient about having those kind of absolutes? Depends on what the heck you mean by usual, right? Well, sometimes, occasionally, okay. There's a couple that you might use, and we'll get to those in just a moment here. And the worst one of all, and I still see them out there, are the negatively worded ones. And we'll talk about that in just a second. If you do anything, stamp those out. You never want to see those. And you'll learn why. So good question should be easily answered by someone who knows the material as opposed to me, who is a lucky guesser, because you wouldn't want me passing the board exam and getting licensed as a cardiologist. Not that that would happen, but still, because I'm a good test guesser, you wouldn't want that ever to happen. To minimize the chance that someone who doesn't know the material can guess the correct answer. They should be well constructed, one best answer, cover the options rule. Okay. So why is, well, trivia is one thing, or totally irrelevant, but how about, why is all of the above? Anybody ever see all of the above as a test question? Of course you have, we all have. Why is that not a good measurement of knowledge? Sure, what's that?
Well, you're really only testing a true-false in that sense, a binary.
Okay.
You either have all of the above or one of the other single answers. So it's a less powerful question.
So when you're presented with 4 descriptive options and the 5th one is all of the above or none of the above, how does that get to truth? How does that measure truth? So I want you to tell me what you don't know. Isn't that what it says? Tell me what you don't know. Well, heck, we could be here for 1,000 years, right? Okay. And that's not going to measure anything. Okay. And statistically, those don't perform well at all for obvious reasons. Okay. Because you're not measuring truth here. Okay. You're measuring exceptionality. And in life is full of exceptions. Okay. But when you're testing knowledge, that's not going to be the best way to do that. So the same way with not. Which of the following is not found in patients with X, Y, and Z? Okay. Does that measure truth? Not at all. Okay. Measures exceptionality. use adverbs with the extreme. So you need to be careful about some of these. So relatively common, rare, occasionally. Depends on your experience, right? So anybody in nursing here? Example of that. So you, with your experience. So not all patients are the same. Not all patients, they may present with the same diagnosis, but not the same signs and symptoms and behaviors and those kind of things. And so, you know, that's not the thing you'd want to be able to do. So you probably wouldn't do this, but well, we do some of this. We put lab findings. Well, it gets a little complex. So if we had a radiograph, well, you might have a radiograph, and along with that you have some lab data. Why not just make it 2 questions as opposed to 1, trying to pack everything together? So it gets a little bit confusing. And then this one, of course. Yeah. Because sometimes we think that the longest answer is the right one, so it's very seductive. You see that? Oh, that if I'm going to guess, it's probably the long one. So if you keep them all about the same length, it avoids that, and it makes it more powerful here. So this I drew from this is a session I did with pathologists years ago. So this plasmin deficiency is not unlike. Okay, we're already in trouble. To which of the following except? Now, how the heck? So here, does it make any sense? Where would you start? I mean, if you were a board-certified pathologist, you probably would still be it's kind of mind-twisting, isn't it?
A lot of negatives.
A lot of negatives. You got to think backwards. I mean, you only have a minute. How much fun is it to think backwards? You know, you don't want that. And so, if it was me, I'd put E because it's the longest. Who knows? So once again, bias towards responses. So you, when you're constructing them, inadvertently, gosh, I've written a lot, and maybe some of you had some experience writing exam questions with multiple choice. You know, you're writing them and you're thinking, well, you know, I've given mostly A as the correct one. Let me do some B's now, and maybe do a D here and there, and then you get. Just put them in alpha order. It doesn't really make any difference. So wherever it winds up is where it winds up. So this a little bit better. Most likely, or least common. Those are kind of extremes a little bit. If you're going to use them at all, those adjectives might work best. But once again, covering the options by far the best. So we looked at Bloom's taxonomy. So you go from knowledge. So name 3 neurotransmitters. Anybody, well, not everybody, most of us could probably do that, right? Epinephrine or something. Okay, and a couple of others. So at least you know what they are. And then you think about its application to neurology. So, you know, not so much neurotransmitters, but to some extent. So here's something about knowing about you have to know something about Bell's palsy to know which of the cranial nerves are most likely affected by that. And then problem solving, which would be higher order, and it gets into analysis. Given a patient diagnosis with extremity problems, which is most likely abnormality. So here's, once again, a list of responses. And once again, I put these, there's only 3, but I put them in alpha order. Okay. Anybody hazard a guess as to what might be the... Probably, maybe B, I don't know. But anyhow, but the important thing is here, be able to construct them. So when you develop tests, it's implied by the learning objectives. So once again, somewhat allied to the Bloom's taxonomy. So you're thinking about knowledge questions, thinking about some. So it depends on how far up you want to go. The easiest thing is just to make them all knowledge questions, right? Back in the day, we used to use scanners to be able to, especially when you have 150 students. But sometimes we have that many. Or you can use things like audience response to some degree, and that's another way that you can actually collect data, and we've done that here. So you could use that. So you get the A, B, and C and D responses from people, and you'd be able to get a report. And it's fairly easy. It saves paper and all those kind of things. But when you're being accredited, maybe it's good to have paper. I don't know. So here's yet another example. So this is an alpha order, most likely suggested by. So this, if you were, okay. So what's good and bad about the construction of this test item? Okay, most likely is not too bad. Okay, what's another positive about it, if there is any? Well, I'll put them in alpha order specifically. Okay, so it takes out bias. And of course, what might be the biggest detriment? None of the above. I have a couple of things for you. So I should say, the proper English, Jeff. I have a slide set. If anybody wants copies, I have a couple extra ones here. So you're more than welcome to use these. And I've given out a couple already that you can take with you. Anybody else want to hand out? Okay, so on the back side of your handout, your pre-reading that I gave you, and I asked you to do something that I asked you to do here. So what? Just take a minute, getting back to testing. I want you to write down what you think might be, what are the advantages and disadvantages of an oral exam? Sometimes we've had opportunities for those. Written essays, advantages and disadvantages, just a couple of notes there. MCQs, or D, direct observation. Oh,
Here's another one.
very good. Thank you.
Is yours blank on the back?
Yeah,
This is the other.
that's the original.
Also bad. Sure.
It's a different one.
Do you have any more of the evaluate test methods ones?
So, yeah,
We'll pair up.
it's best once you just, if you would, pair off. I guess that was my intent as a think, pair, share activity. So you can do that together. There you go.
You want to pair up with me?
Yeah, you want to go? You'll go to him and then you want to
Instead of writing
Oh, that's good. Thanks.
Good thing about it, you know, some
Yeah. Maybe it's easier to process. See, oh, yeah. No, it's not you.
It's easier to quantify.
It is, yes. This leaves it up to interpretation.
Which comes from
Bias, exactly.
This is also the ability to break it apart. Most people have skill.
And you can move forward. Well,
Okay, give another 2 minutes.
because you have some measure of
Is this it? Wow. Yeah. Standardization. Might be able to do much. Yeah. And they, this is use how that's a regular.
and erroneous results.
One person.
Because you may actually know this.
You have it. Different rights.
Okay, let's just going to wrap up here a little bit. We can share with one another, but at least gives you an idea of, once again, the variety of exam or other exams that we might, or measurements that we might do. But what's a good thing about oral exams, if there is one?
I would say it's similar to a written exam, where
Okay.
you can, versus written exam, you can just say what you think it is, and for the most part, as you talk, you can probably gather some of the things that you
Okay, yeah. Let's take it from the standpoint of the learner. Okay. Responding to an oral quiz, an exam. So the positives there are what? You can.
instead of having to write it out.
Okay.
you just say.
So there's some advantage. Anybody else think of an advantage as a learner? How about as a teacher or faculty or examiner? What's the advantages of having oral exams for your learners?
You can hear the person describe their answer.
Okay, yeah, so because it's somewhat individualized for sure. Maybe original, that could be something that, an approach that you might, it could be, well, hopefully it's correct. It may not be exactly what they had in mind, but still, okay. Somewhat interpretive. Could be a whole variety of things based upon experience too. That's a good thing. Yeah.
Feedback can be more immediate, more connected.
Very good. Oh, very good, Rob. Okay. So that some of the downside about oral exams.
You can lead them to the answer you want.
Yeah. So the reliability is harder to control. Now, years ago, I used to do that in surgery. We had oral exams, and I used to videotape because otherwise, so the faculty then would play back the video and get some. It's kind of like what we do with OSCEs and those kind of things. So oral exams are harder to construct. You're thinking on your feet, and if you recall, for those of us that, well, masters or PhDs, especially that, when you have your final oral exam in front of the panel of experts. Anyhow, the point being. So, oral. What's the next one? Multiple choice? Written. So, essays. What's the advantage from the learner's perspective about a written exam? Maybe,
Really elaborate.
maybe some of the things that you already touched on.
Yeah.
Exactly that.
Really
So
elaborate.
that too. And some of us can write better than we can talk, perhaps, okay? Put it in written form better than we can orally communicate. But you can also compose it to a certain extent. I mean, when you're speaking extemporaneously, it might not be as coherent. But when you're writing it, you can do a little bit of editing too at the same time. Okay, and maybe you can show off a little bit better that way as opposed to verbally. From a tester's standpoint, or a teacher or an examiner, what's the downside about written exams and essay exams?
Yeah, great.
It's 3 o'clock in the morning, and I've got to get these done, and I'm just the last student, and Linda's paper is in front of me, and I'm drinking about 10 cups of coffee, and I can barely see straight, and I'll just, I'll give her an A. I don't know what the hell. I just get it done, Well, it's not good for either one of us at that point, and I've had to do that. Some of us have had to do that, so it's a little bit tougher. But there's an advantage, though, and getting back to be able to be more explanatory, because isn't that what life is when you're writing? Well, not so much in the chart, because chart notes are quite a bit different, but still being able to express that. Multiple choice questions, we should get that one pretty easy. What are the positive parts?
The answers are pretty much.
And you get a large amount of information that you can collect. Okay, depends on how you write the questions, for sure, as you've seen.
If you don't know, you can still guess and maybe get it right.
Depends on how you construct the test.
Very
Back to that again. Okay. And then the last one is what the observed. And so, be they OSCEs or simulation, or what we do, especially on word rounds, we have, especially in pediatrics, we do a fair amount of assessment of the residents in terms of their. So we have a valid instrument that we've developed. Took us a while to get there, and we use it reliably. Those are the two major elements, because what I may observe could be different than what you observe. Just like we're doing interviews, isn't that right, Rob? Iterator reliability, awesome, exactly that. I'm a hawk, Rob's a dove. They've got to. We got standards here. They've got to exhibit that. And I says, well, give them a chance. They can grow. There's room for. But anyway, so we get these kind of things. So once again, so there are many ways that we can test. Gives you an idea how we do that. Multiple choice is the best. So you can go back to your seats if you wish at this point here. So let's look at, in closing here, let's look at a good classroom test requires planning. Many of us do it at the last minute. I'll just throw out some questions and find out what the heck that they might know. Linda was asking before about writing survey questions. It kind of falls in that same category. Just throw a bunch of stuff out there and see what we wind up getting. Not that we actually do that, but many of us close to that. Okay. So think about your content areas. What are the cognitive levels of your learners? Back to Bloom's taxonomy again. Here's a test blueprint. Now I know it's a little bit elaborate, but I must tell you, it follows what we want to do here. So here's kind of Bloom's taxonomy here. Here are some of the subcategories that we want. Okay. So how many questions? So let's see, we've got, 50 questions. So here's blood, what is it? ABO classification. What is it? Blood types, right? Okay, so blood typing. It's predominant, okay. So RH factor, got 25 questions for that. We only have whatever the P system is, only 10. So we're thinking about so what's most important in the course? So we'll load those more questions loaded with the ones that we really want. Okay. And they're all multiple choice. You might have a couple essay questions in there. So having a plan like this together tells you where the strength of your instruction is. Okay. Most of them are knowledge. There's a few problem-solving ones. So it's just one way, having a test blueprint as an example. Now, let's see what on the back side. So yeah, so you have this handout here. It's the worksheet for test item writing. Okay. So here's the basic point here is when you get results. So what I want you to do at this point is you can just look at this too and probably decipher. So we use statistical methods, discriminant, point biserial. We do a correlation study. So the important thing is here, you get all the exams back, say it's 100 students. Half the class is smarter than the other half, right? Just cut them in half. So let's say, for instance, even number here, so we have 4 here and 4 here. So these are all the bright students, pardon me. The ones that get most of the answers correct. And then these, what they call them, they could be the weaker students. So wouldn't we want most of the bright students to get the answers correct?
Yes.
As opposed to the poor students to get the answers correct? Because if the poor students are getting the answers correct, what does that tell you about the exam question? It's not a good discriminator between the two. Vice versa. So if both of you, both groups, get almost all, or all, in this case, you're going to see 100% of the questions right. Is that necessarily bad? You get, okay, both groups, say, well, we'll get back to our scale here, but say there's 10 exam questions, and say there's 2 where both groups get 100% on the exam question. Does that mean it's a bad question?
It depends on the level that you're trying to measure.
Yeah, it could be, because if you want everybody to have some basic knowledge, my gosh, I feel so good as an instructor, the basic elements of platelets or something like that. I want to get that across. Everybody got it right. I feel good that that's exactly what I wanted. Okay. But then there's some real finite ones in there too. There could be something about some mutation that I had discussed in the class that I want everybody to know, but only the bright ones got it right. So there's various ways of looking at these results. So getting 100% on a question could be a good thing, but you don't want to have too many of those, do you? But then what's the point of testing if everybody gets all the answers right? Or conversely,
Everybody gets wrong.
everybody gets one right. It's not 100% on any one of them. So all these things go into. So like I said, it's part of a larger course that I've done before on this very thing, but by the same token too, it gives you better. So the idea about discrimination is comparison of the percentage of upper group, if I can call them smarter students, versus lower level students. Okay. So the discrimination goes basically this. So generally, and I put the number 0.35. So without getting into much of the statistics, though you see a little bit of it here, that's about where you'd really want to be with a good question as a discriminator, around that 0.35. If the discrimination index is positive, then it's a good discriminator. If it's 0, then there's no discrimination. It's either all correct or all missed. Okay. So this point biserial business. So here's kind of the gradient here. So about 0.30, it's a good question. 0.2 is fair, and 0.09 is low. Now, these are kind of ballpark numbers, but you're going to see on your scale here in just a moment. So when you're doing a test blueprint, think about having your learning objectives, level of instruction that you're going to do, how you're going to be able to attest and be able to analyze the test, and then use that to modify instruction. How many of you came to the session that we did on curriculum development where I had the template? Okay, you start with your learning objectives, the instructions that you're going to have, the assessments, the outcome. It's circular. So every time you're going to teach that course, you're going to improve upon it. Your testing is going to tell you how good the course is. So it's on your back side there of your sheet. So if you want to take a look at that, and you can just actually, you can do that in pairs too. So if you look at the questions, we have 10 questions here, right? The upper 27% of the students and the lower 27% of the students. Which question do you think is a good question? They had a guess? Number.
Like this whole percentiles.
Yeah, which one?
So I would pick the lowest one, number 7.
So you think 7's actually, because 0.6, so 0.32 would be a good one. Because once again, all the bright students got it right, which is not a bad thing. Do something you want. You know, it could be a little bit less, it could have been 94%, but the point is that the brighter students, these are all your bright students, okay? Got it right. And to some extent, some of your poor students also got it right. So because you don't have too much discrimination between them. So anyway, so this is a test blueprint, and it gives you sort of an idea. You can look at this too. You can analyze this between the lower, upper level students and lower level students. I just present this to you as a way of using this as a testing measurement to know the performance. That's what this is about. Performance of the test, which you'd like to think is also a performance of the instruction. Okay? Because once again, what you intended to teach, what your learning objectives were, the methods that you used for instruction, the testing that you had, remember the blueprint kind of matches back to your instruction level. Okay. So kind of putting this together, you get these kind of printouts that tell you a little bit about how well the tests perform. Now these are only multiple choice questions. Oral exams, or oral and written exams, would be a little bit tougher, but you can still get the same kind of a thing. So anyway, like I said, this is just one method by using correlations to be able to see outcomes. So the whole point here is that to measure learning outcomes with exam questions that match your learning objectives and being able to have the performance to do so. Anybody have any questions or comments about our session today? So what did you find most useful in writing test questions today?
I would say the alphabetical order of the choice.
Okay.
When I was in school, my teachers obviously didn't know
Yeah, well,
how to make the right questions.
So one of the yeah, I got another minute or two here. So, you know, when you're on faculty and you've got esteemed professors, and I'll just put out a name here. He doesn't do this, but Dr. Cunha, who would be a good example. He has been here a long time. Well, Dr. Cunha, too. I'm way better at these things. Dr. Cunha, who is infectious disease, if you don't know, has been here a very long time. He's on our committee. So we ask all of our faculty to submit 2 exam questions. Okay. And his question comes, and it's got none of the above except all of the above and all those kind of things. We're stuck because we don't want to dismiss him because he is an important dude. But by the same token, too, the question just doesn't work. So you got to be a real strong course director and say, no, we will help you redesign your questions. Or it's just a STEM that's, patients with elevated blood glucose levels, and then 4 responses. I mean, God, it could be anything. So you can't cover the answer, cover the options, and ever be able to even think about what the answer might be. And then always avoiding the dreaded what?
The negative.
Adjectives.
Oh.
Like what?
Always.
Except, always, none of the above,
Never.
never, these kind of things, because they don't measure, first of all, they don't measure truth. And you'll find on the exam too, that even the brighter students have trouble in 1 minute trying to figure out what the heck they're trying to do, because it doesn't measure truth. It doesn't measure truth at all. Okay. Tell me what you don't know. Good luck. So that's basically it. So hopefully you have opportunities for writing exams, or test questions. Audience response can work out well for this too. We often, as I showed you, we use this in medicine. So you have a stem with a patient vignette, and you have a couple of responses there. You get responses to those and be able to measure them. So. Anybody have any other insights or any other comments? Okay, so what do we have next week then?
Good question. So next